One. Good morning. I'm Phil Owen with Communities for Recovery and the Targeted Response Team. Thank you for tuning in. This morning we have William Terry from Integral Care's Recovery Navigation Services. And Will, would you mind introducing yourself and tell us a little about what you do and clue us in as to what type of services Recovery Navigation Services has?
Oh, thanks, Phil, and thanks for having me. My name is William Terry, and I'm the practice manager for the Recovery Navigation Services team over at Integral Care. Myself, I'm a clinical social worker and peer support specialist supervisor. I've been with Integral Care a little over 5 years. The Recovery Navigation Services team is designed to be a single point of entry for clients who need basically an intake for substance use services to try to get connected to resources here in the county for substance use treatment. So this team is designed to know about all of the substance use treatment options that are available through Integral Care as an agency, to also know about all of the treatment providers that are available in Integral Care's extended provider network, and to also know about what substance use treatments maybe just be available county-wide that maybe don't fall into those other two categories that we might need to help connect clients to. This team is comprised of 2 master's level clinicians or social workers, 2 peer support specialists, and 1 medical provider who is a waivered provider who can prescribe Suboxone and Librium and buprenorphine for clients needing that level of care. So the team is designed to basically get referrals for clients who are trying to figure out how to get into treatment, what are the options, what are the pathways to get access to those resources, and then to provide support along the way while those clients are trying to find a pathway into those services. So we provide a lot of short-term support, typically around 7 to 14 days, while a client is trying to get into a treatment program, whether that's outpatient counseling all the way up to medically monitored inpatient detox and residential treatment. And once we've connected a client with that level of care, we typically create a, like a transition plan to transition their services over to their new provider. And that's basically the function of the team, is to be like a hub in which the clients can get navigation to different substance use options depending on what their level of need is.
I love that. So navigation truly is exactly what you guys do. So one of my questions would be, is I've had some other team members from Integral Care on, and I've spoken with Marlene Buchanan, and one of my questions was if somebody needed services, how do they connect to them? And we talked about the 512-472 helpline, which is Integral Care's helpline. Will they connect with the Recovery Navigation Services the same way?
Yeah, that's a great question. And you are absolutely correct that, Integral Care is still open, accepting agency-wide referrals by calling 472-HELP. To that same line, psychiatric emergency services is still open and operating. And anyone in a psychiatric or substance use crisis can call same day, 472-HELP. And when clients connect with that line, they do help those clients get linked to services that RNS provides and links clients to. And so, yeah, that is the best pathway to try to get services from the team, is by calling into the 472 helpline. A lot of those clients, we help them get navigated, and it's the best entry point into getting access to all the services that Integral Care has in general through that helpline. Okay,
then let's go back to services in general, specifically to Recovery Navigation Services. So I know when you're talking about that you have someone waivered, that they're able to prescribe Subutex or Suboxone, which is a medically assisted treatment for people suffering from opioid use disorder.
Right.
But some of our listeners may not understand what treatment services are available to people. Can we kind of run through the list of services with regards to detox and treatment, MAT, and so forth, just so people can kind of know it? Because I'm hoping to have some family members that tune into this that can idea and better educate themselves as to what options are out there.
Yeah, absolutely. So you're exactly right that medication-assisted treatment is one of the services that Integral Care has. So this is a service designed for clients who are living with an opioid use disorder, who are maybe needing access to buprenorphine or Suboxone in order to effectively provide a medical intervention for either management of an opioid use disorder or detox from an opioid use disorder on an outpatient basis. We have a couple of different teams that provide this level of service at Integral Care. One is the MAT team, or the Medication Assisted Treatment team. Another one is the Office-Based Opioid Treatment Program, or OBOT as it's called. Another program that we have that provides this service is the Outpatient Detox Program. And then we also have our narcotics treatment program over on East 2nd Street. And all these different services at Integral Care provide, intervention and assistance for clients who are living with an opioid use disorder. For some of those services, they're also for clients who are living with an alcohol use disorder and are maybe interested in an outpatient detox for alcohol as well. So those are some of the kind of like medication based programs that we have for clients needing assistance with opioid use disorder or alcohol use disorder. And a lot of those services are also, bundled with comprehensive case management, peer support as well, ongoing substance use counseling. And those are some of the programs that my team helps gets client
So
get clients
it's not
into.
just medication. Obviously, there are other supports in place. I know you mentioned a counseling would be one of those services offered, and then you talk about
Mhm.
support. Can you tell me what peer support means?
Oh yeah, absolutely. It's so essential. Along with the usual services that a client may receive with regards to clinical services, things like counseling, case management, motivational interviewing therapy, our peer support services are really essential and have really grown to be an integral part of the service array at Integral Care for substance use counseling and mental health services as well. So our peer support specialists are people on the substance use side, at least, who are living, who have basically reached a stage of recovery with regards to a prior substance use or mental health disorder, and they've gotten to a place where they are sharing their strength, hope, and recovery with others in a format to help inspire and provide strength and hope to other clients. So on my team, we have two peer support specialists, two folks who have, gone through recovery themselves, are now in a state of maintaining their recovery, and have gone through additional training to become on the pathway to certification as a peer support specialist or already certified. And they help us basically inform our practice on how we engage with clients who are living with substance use disorders. They do it through a couple ways. First of all, by relating to the clients in a non-clinical way. They relate to our clients as peers, as someone who is, sharing their own lived experience in a clinically appropriate way to help inspire hope and show that recovery can work for our clients. They also help, provide their own insights to our team when it comes to the way that we deliver services. How can we adapt our services to be more appropriate for clients so that we can understand things from the perspective of someone who's gone through recovery themselves and is in a maintenance phase of their recovery? And a lot of our substance use teams at Integral Care employ peer support specialists. And I certainly feel very fortunate that we have two peer support specialists on the recovery navigation service team so that we can learn from their experience and so that the clients can get the added benefit of talking to someone who's in recovery themselves.
Very good. So we've kind of covered the medication assisted treatment part for that option. What might be, so are we talking for treatment options? Are we talking about, is detox one of the options?
Yeah, Integral Care has an outpatient-based detox program that helps serve clients who are appropriate for like an office-based outpatient detox from either alcohol or from opiates. And that's a program that is just called the Outpatient Detox Program, and it is still accepting referrals right now. I believe most of the referrals for outpatient detox come from either clients calling into the helpline or from clients getting referred via OSAR. For the recovery navigation team, if we're working with a client who is appropriate for and in need of like a medically monitored detox, we'll explore the internal options that Integral Care has. If this is a client who maybe might benefit from an inpatient detox, we will collaborate with OSAR or we'll collaborate with the network of substance use providers that Integral Care contracts with to see if maybe there's a placement in our network that we want to place clients with. But we also collaborate with OSAR at the state level to see if there's another option that we may want to look at with regards to inpatient detox. So typically we have different pathways that we may try to help a client get linked to with detox, and really it comes down to what is going to benefit the client the most and what are they most able to access with regards to the timeliness of their need and other with regards to what resources are available in general.
Right. So if somebody goes through the treatment program at Integral Care, do they have shelter options after that? Say they don't have a family to go back to, or they've been experiencing homelessness prior.
Yeah, that's a great point. That is a very large area of need in Austin. Our agency serves a lot of clients who are living with homelessness, who need extended support to get access to not only just recovery housing but shelter housing, rapid rehousing. Um, well, in general, we help clients get access to the different coordinated assessments that ECHO helps coordinate. We have teams that provide this assessment, in-house. We have teams that also help clients get access to locations that provide this assessment, which is called a coordinated assessment. And this assessment helps clients get connected to the various housing resources that are available in Austin. And then we have teams that basically specialize in helping clients navigate that system as well of the different housing options. When it comes to like recovery housing, my team and several teams at Integral Care do also help clients navigate the options when it comes to sober supported living here in Austin. We help clients look at different vacancies that we're aware of in sober housing, also help clients walk through the pathway of like how can you get maybe access or determine your eligibility for funding for sober living. Some of those resources are provided by the county that we help clients try to access. In other cases, we found a lot of the recovery houses here in Austin are very generous and understanding of helping clients kind of get set up, depending on their availability and capacity. So there's a couple of different avenues that we may help a client go down, whether it's getting access to shelter housing or maybe rapid rehousing or permanent supportive housing. We have teams that specialize in getting clients connected to those services that my team would collaborate with. But in addition to that, if a client's maybe looking more for like sober supported living, we may help them look at the different options that are available here in the county and help the client determine what's the pathway they can go down to get access to that level of resource as well.
Great. So if somebody comes into services, say I come into services at Integral Care and I enter a detox program, then a treatment, I'm attached to a caseworker or a team. If I attach to, say, a counselor, a caseworker, and a peer specialist, would I maintain those same connections throughout this linear process? And if I went into sober living, would I still have my caseworker, still have my peer support? Would I be connected with Integral Care Services beyond treatment, I guess is what or IOP?
Yeah, absolutely. It is a priority and a standard practice for us to maintain long-term services with clients for their case management, their mental health needs, or their medication management after they've entered into other services. So yeah, absolutely. Our outpatient behavioral health teams do maintain ongoing services for clients regardless of where they're living or what service array they're accessing. And the same is true for a lot of our substance use teams as well. Large majority of our substance use teams provide ongoing long-term care for clients that continues based on what the client's level of need is. So yeah, they would still have access to ongoing substance use treatment, mental health treatment while they're entering into sober living or other treatments as well.
Great. So we talked a little bit about you guys are still taking clients, and with the COVID-19 situation the way it is, I know we've talked about adapting. So I know there's the helpline, the 512-472-HELP.
Right.
I'm going to also pull up your website real quick. If I could find it to share again. I had it up. Let's see. Well, let me just go back from that. So my question is how have services adapted to the COVID-19 situation? Because I know prior, I could bring somebody into psychiatric emergency services over off airport
Mhm.
and walk in. So
Yeah.
I know that is not the advisable thing to do right now, correct?
Um, I would say probably the best option to look at if you have if you are looking for access to psychiatric emergency services, is to call into 472 help. Typically, the hotline staff, who's very well trained and knowledgeable, can help give the client direction and guidance on how to access psychiatric emergency services, which is still open and operating. Um, a lot of our services have transitioned over to like a telehealth or a like a remote support setup. However, there are services that still require a different type of contact, and those are being provided if the uh, if that's the way that the service array has to be delivered based on the level of need. But we are still following, of course, all the CDC and Austin public health guidance to ensure our staff and individuals we serve are staying healthy. And our top priority is, of course, to continue to take care of those that we serve. But I would start most of my uh, inquiries when it comes to helping a client get access to like an emergency psychiatric service by calling the helpline, as they can help provide the guidance and the basically information on where to get access to the level of care that a client is needing. And they're a huge important part of our navigation system for clients to get routed to the right team.
Great. So it's business as usual at Integral Care, with the exception of stay in your house, make that phone call first, because it's just as easy or best to get connected through the helpline.
Yeah,
I pulled up the
absolutely.
Integral Care site. Sorry, I pulled up their Integral Care site. I finally figured out how to share it. So here we have
Right.
integralcare.org, which can also let you know what other services are available, as well as connecting with an email to get information from.
Absolutely.
Very good. Well, do you have anything else you'd like to add?
Um, I would like to just say that I appreciate the opportunity to touch base with you. Communities for Recovery is a important member of our continuity of care for all of our clients that we serve, and it's such a great resource for our clients who benefit from the recovery coaching and essentially the kind of drop-in nature of the services that Communities for Recovery provides. So I would just like to express some of that gratitude. A lot of our clients have gotten great options and great aftercare over at Communities for Recovery, and great basically support in their recovery journey. And so I would love to just express that gratitude over to Communities for Recovery for their extended work, of course.
Well, thank you so much. I know we share the same sentiment with you guys. You guys are very important to what we do as well. I will have one last question for you, and that is,
Sure.
if you were able to create your own flavor of ice cream, what would
What a great question. I would probably go with some kind of hybrid of like peanut butter and jelly, because
Nice.
my favorite snack, peanut butter and jelly sandwiches. So I would go with
Nice.
something like that.
Great. Well, thank you so much, William Terry from Integral Care Recovery Navigation Services. I'm Phil Owen with Communities for Recovery. Thank you for tuning in. Until next time.